Hey YouTubers, Guardian Mike coming at you, and I want to talk to you about the medical setting, mental health, and asking questions. And I'm going to set the scenario up and ask, I think it's very important in my experience that with the mentally ill, that families, if you can, you accompany it, and you have the top 2 or 3. And I'll give you an example. Someone who is being interviewed by the doctor, and the question's whether or not they're doing good or bad. They've had maybe 7 hospitalizations in 9 months. They've lost 100 pounds, and so the family's concerned, very concerned, thinking the patient's dying. This is a mental health patient. And family, I'm the lawyer, I'm there at the care conference just to see if there's any resources or services we can get. And so the doctor asks all the questions, there's nothing to alert him. I had brought with me a social worker and that represented a family. Social worker asked 3 questions. First question, now I want you to underline this. The question was not directed to the patient, are you hearing voices? The question assumed voices and said to the patient, 1, how are the voices today? And the patient's head went down, looked at the floor. Second question, are you hearing voices today? Head went back, it was stayed down and said yes. The third question, are the voices telling you to hurt yourself? And the head bobbed yes. No verbalization, but just the head moves. 3 questions, and the psychiatrist was ready to call 911 to have hospitalization. So I just share with you, family, surround yourself with caring people and listen to the summary that Dr. Sam can cater. Can we bring people to the conferences? Can family have input? Can we have social workers? What do you do with the mentally ill that are not always articulate and they're timid?
That's very difficult, because it is most helpful if you have the right background information, because if you're relying only on those patients, they will not give you the information you need. You don't know what questions to ask. The family helps give you background information and helps you to know what would be an appropriate question to find out about, because it gives you a warning signal so you know kind of what you're trying to look into. Second is that nonverbal patients, somehow you have to get them to relax and become part of it, because there's a tendency for them to stay separate from it. And to do that, in the case example you gave, they were able to do it in a nonverbal, non-threatening way where the patient had minimal effort on their part to participate, and that allowed them to participate. And so I think that was a good skill at work. But the other thing is it normally takes lots of time, and because it takes lots of time, there's a tendency for us not to give enough time. You know, it may take, what would take a 10-minute interview with a regular patient may take 30 minutes or an hour with them. And so that makes it very difficult when you're scheduling multiple patients and you've got an agenda and you have time constraints and even people paying you who expect you to be productive. And so that's one reason I think that we rush through it. We try to get things on our own agenda, but the risk of that is that you don't get necessarily the most accurate information when that happens.
So the point for those of you out there, families that are helping, you don't have to get angry. It's not that the doctor's evil or he's participating. Sometimes he does not know the family member the way you do.
Yes.
And it's okay to ask a few questions. Don't, and I call it moving the cheese, you don't have to go to fisticuffs. You don't have to hate the physician. You have to pound the table. Just ask a couple precise questions in his presence and you'll get a response. It's been my experience.
Yes. Physicians are not God. We're just human, and we can use a little help from time to time too.
All right, that's wonderful. Thank you. We'll come back. We got a follow-up, folks.